Love staying informed? Subscribe now and get unlimited access to local news, weather, and sports for just 99 cents a month for your first 3 months at inforum.news/join. Read every story, listen to every podcast, and download the apps that keep you informed and on the go 24 hours a day. So head to inforum.news/join right now to subscribe. What are you waiting for? Get 3 months of local news for just 99 cents a month at inforum.news/join.
Welcome to Plain Talk. And, you know, at the legislative session, there's always so many issues. I think that's one of the downsides. I think a lot of North Dakotans like our part-time legislative session. One of the downsides, though, is that because it's so shortened, there's so many issues to cover. And sometimes it's hard to give what are really important issues the breadth of coverage and discussion that they deserve. One of those discussions we're gonna talk about in the first part of the show here. It's House Bill 1416. It was introduced by State Representative Dwight Kiefert. He's a Republican from the Valley City area. But before we get into that, I should note my co-host today is not Ben Hansen or even Chad Oban. It's Jamie Selzer. Ben had work stuff to attend to this week, and maybe if I started paying Ben, he would show up for the podcast more often. Although, now, having said that, while we're recording, I should edit that part out lest he get any crazy ideas in his head. Jamie, thanks for doing the show with me.
Happy to do it. Once again, I mean, I'm not your first choice. I'm not your second choice. I imagine I'm not even your third choice, but I'm happy to be
there was a third choice. Case. I'm not at liberty to mention who the third choice was. But Jamie was definitely, no, I'm kidding. Jamie's great. I'm
in the top 5. That's fine. As long as I'm in the top 5.
Top 5, you're doing good. Top 5 for a small North Dakota politics podcast. Put that on your resume. My guest joining us is Dr. Duncan Ackerman. He's an orthopedic surgeon. He's a partner at the Bone and Joint Clinic of Bismarck, also Surgical Associates in Bismarck, and also is a representative of a coalition of, I think he said, about 55 healthcare interest businesses who are calling themselves North Dakotans for Open Access Healthcare. They are backing House Bill 1416. And what House Bill 1416 does is it essentially makes it so that insurance companies, when they're offering, because when you're getting your health insurance, we all know like the in-network versus out-of-network. We've all dealt with that, right? Certain care providers are considered in-network, and if you go out-of-network, it might cost more or things like that. What their argument is what House Bill 1416 does is it makes it so that independent providers, have to be included in a health insurance plan. In fact, I could read you directly from the bill. I quote, "A health insurer, including the Medicaid program, which is part of an integrated delivery network, may not obstruct patient choice by excluding a healthcare provider licensed under the laws of this state from participating on the health insurer's panel of providers if the provider is located within the geographic coverage area of the health benefit plan and is willing and fully qualified to meet the terms and conditions of participation as established by the health insurer." And let's go to Dr. Ackerman to translate that into English for us. Duncan, what do you want to see happen?
Yeah, so the genesis of the bill essentially is, over the last, since I've been here, actually been here at the Bone and Joint since 2009, what we've started to see and continue to see are plans that had zero out-of-network option expanding. So again, normally most other plans, so they have most other plans, for example, like a Blue Cross Blue Shield plan. The way that they're structured in our state is when they offer an insurance plan, they are required by state law to have an out-of-network option. The only entities that have that ability to sell a plan with zero out-of-network options are HMOs, and there's 2 in our state. One is Medica, which is relatively small. The one that this specifically, House Bill 14 specifically addresses, is the HMO that's housed within a vertically integrated network. So with those plans, the insurance companies can sell those plans, and they can sell those with zero out-of-network options. So what you buy is what you get. The providers that are defined within their directory are those the people you can't see. So if you want to go see somebody else, it's 100% out of pocket in those particular plans. And what we've seen, like I said, is those plans have been continuing to become more popular, if you will. And what it does, it can obviously creates concern, especially for those of us that are independent providers in our state.
Well, and to be clear, the company you're talking about that's vertically integrated is Sanford. Medica is the other one, but Sanford has big market share, and a big part of its market share is, let's be honest, it's the state of North Dakota. They provide the health insurance for PERS, which is the Public Employee Retirement System, which also administrates the insurance policy for state employees, which is that's a big chunk of business right there. And I guess what first interests me about this topic is the whole idea of vertical integration. I mean, the idea that your doctor is also going to work for your insurer, that seems a troubling conflict of interest. Now, your bill doesn't address that. It doesn't stop that. It's not really about that. But it kind of feels like we're treating a symptom of that problem. Is that fair to say?
I think that's completely fair. I think there's bigger issues, and we see this at the national level. I think if you do some research on the FTC is actually looking at, the potential antitrust issues with vertical integration, particularly between a health insurance plan and a health system, because they say that they're firewalled, but it's very, very gray. So it is a big concern for sure. And if you look at California is the best example of what happens with large vertically integrated systems, is that Sutter Health out there, I mean, they grew to the point where they owned all the physicians, they owned all the hospitals, and they were selling insurance plans. So they basically in that market started to box everybody out because they had significant control. It's a much smaller scale here, but I think that is our risk, especially for our state where we have, we don't have a lot of people here. Our population is small. So I think even small changes in the insurance groups around our state have significant impact on the ability to get care, and especially for the independents in the state.
I'm curious. Can I call you Duncan, Dr.
Yeah,
Ackerman?
please do.
Okay, all right. Obviously, in this case, I mean, it's Sanford. By the way, I should start by saying anything I say that sounds like I'm defending an insurance company is only so we can have a robust discussion here.
Yep.
Pulling back my old high school debating skills of debating sides I don't necessarily agree with. But I think when it comes to consumers, including a business who, provides insurance for their employees, having a low-cost option where if I as a patient can go to basically one place, in this case should be Sanford or whatever other company might exist somewhere, and have all my needs taken care of and not have to deal with maybe the red tape of an insurance company as much because they are integrated. How is that not good for me as a consumer if I'm getting good care at a low cost and my employer's able to provide me insurance at a lower cost?
Yeah, no, I think it's a great question. And I think, as far as if you look at HMOs just in them themselves, if you look at Medica, for example, again, the idea behind that, the idea behind the plan, obviously, is what they do is they're not a health system, they're an insurance company. So they go out and contract with providers, and with that exchange, that they bring volume to the providers, and then the providers are then therefore willing to take a lower fee schedule, if you will. So it's kind of a win-win for both. The problem here, I think, is that when the insurance company and the health system are, living under the same roof, if you will, I think it does the same thing, but they have a distinct advantage because they are the only vertically integrated HMO in our state, number one, and then number two, like I said, if you ask yourself, well, if in the Medica, for example, if they're actually negotiating with outside entities to come to an agreement, when you're negotiating with yourself under your own roof, really is that true bargaining actually happen? I would argue that it doesn't. And the bigger issue, I think, too, is that even though they have a network of physicians, and if in testimony yesterday, they state that there's 55% are actually Sanford providers, in their Sanford True plan, which is their closed network plan. 45% are out. If you look at that, the majority of those providers are non-physician providers, so non-MD, non-DO, other than ophthalmology and radiation oncology. So the large part of the referring base, that 55%, I mean, they kind of control those referrals. And what we hear a lot is that they're sort of self-steering. You know, you see a Sanford, even I hear that in patients that have the broad network plans. It's like, well, I saw my Sanford physician and they said I have to go see a Sanford provider, whether it's therapist or other, and they, you know, are kind of steering those patients back to themselves. So again, with that, I think it you know, that sounds more monopolistic. And I think today, I don't think, you know, if you look at it from a risk of a monopoly, I think it's there. I get it. But if we ignore it, I think 5 years from now, with potential expansion to other health systems that are at risk, it should be a significant concern.
You know, one thing that, because I think Jamie makes a really good point, and I've heard others make it as well, that, I mean, listen, everybody's screaming out to save money on their healthcare costs, whether it's a business trying to save money on insurance costs and red tape and overhead for providing, you know, an insurance plan for their employees, or if it's obviously the patients themselves who are trying to avoid, you know, get lower premiums, avoid out-of-pocket costs, what have you. Everybody's looking for savings, and I understand that. What worries me, and I think where this gets a little complicated, is that I think we tend to look at this situation through the lens of routine care, where, you know, I don't want to besmirch the folks at Sanford who employ a lot of great physicians. I've been to Sanford doctors. They're fine. They're great. You know, I think the problem is where this becomes important is, I don't know the right word, unique medical situations or serious medical situations. Like if you have a serious illness or you have a serious injury, and there may be some disagreement over what's the best path. You know, is one path more expensive? Is one path not more expensive? That is not your typical situation when you go to see your doctor to get your physical or something like that, or to get your annual checkup or to get a test or something. You know, those are crossroads in your life. And at those crossroads, I think sometimes we don't think about those. I think it's really important to me, I would think, to have a choice to say, well, the orthopedic surgeon at Sanford is saying this, but that orthopedic surgeon also works for my insurance company. I'd like to go outside of the Sanford system and get another point of view from another expert. I should have that choice. But the problem is, and you will always have that choice. The only problem is if you've chosen this plan, that's going to cost you out of pocket. And maybe some people are okay with that. I don't know, but to me, it's really, and again, broadening this debate to a larger discussion about our health insurance system and healthcare system. I think a lot of the problems we have now stem from a lack of choice and a lack of consumer involvement in the economics of medicine. And I worry about anything that moves us further down that road to where we have fewer choices and less consumer engagement. We need North Dakotans, we need Americans to be more empowered in their healthcare, not less. And that's why I guess that's why I like this bill. I think there's a lot more we need to do, but as a starting place, I guess that's why I like. Does that make sense, Duncan? I mean, that's how I'm, as I guess, just a patient. That's how I'm looking at this whole thing.
No, I think you're right, and especially in the young healthy population, you're right. Most of us, when we choose healthcare insurance, we're thinking it's like, I'll just need it just in case something does happen,
break a leg or something.
Just like you've described, we heard testimony, you know, both in the House and on the Senate side. You know, for example, one physical therapist here in town, her 6-month-old had something called idiopathic hydrocephalus, where they get water around the brain. Well, you know, if there was only one option, the kiddo probably would have had a shunt that would have had to deal with her whole life. But she was able to choose to go to another, because of her health plan, to go to another provider, and they essentially replumbed the brain, if you will, and the kiddo was doing fantastic. So again, that's sort of one of those extreme issues. We heard another one yesterday too, a gal that has skin cancer, squamous cell carcinoma. So it's a type of skin cancer. That skin cancer, you know, most people know about melanoma, but that type of skin cancer can also metastasize and kill people. The trouble was she's in a network where she couldn't get access. It took her forever to get in to see a provider in the dermatology world. Saw that provider, said, well, I can't actually do your procedure. You have to then go and see if you can't find another surgeon in network, again, waiting more time. She couldn't get in. She said, well, your options are these. You can drive this far, drive that far, or, you just have to kind of wait. Well, when someone has cancer, they kind of want especially that's treatable. There's a dermatologist literally right across the street that she could go see, again, if that person was in network, or choose to pay 100% out of pocket for that care. So I think that's what this bill, I think, protects, even though, we describe network adequacy. You're right. I mean, do you want to, if you have a gallbladder problem, do you want to go to the in-house, in-network provider that maybe not the best gallbladder doctor? Or do you want to have somebody in town that's the world's best gallbladder doctor you have the choice to go see? And again, this allows folks to make that choice. I think we have to make another important point here is that this is not, this is called, an any willing provider bill. I think it's more patient choice is really what this is about. But it's not any willing provider, any willing price. Those of us that are outside of this aren't asking to be paid more. What we argue too is that, I think independent practices, if you look at them, tend to be, a cheaper option or a lower cost option. For example, to use your example for breaking a leg, there's two sort of ambulatory surgery entities that are defined. One is a true ASC, ambulatory surgery center, that's in the independent side of the world. One's called a hospital outpatient department. So that's the outpatient department at the hospital. Just the way things are set up legally, the ASCs typically can only charge about 50% of what the hospitals do. So someone breaks a leg, if you have it done at a HOPD where you can go home, it's going to cost you twice as much. So if you think about that from a deductible perspective, because a lot of people are, buying, especially young, healthy people are buying plans with a significantly high deductible, all of a sudden your patient out-of-pocket portion, is twice as much. If you go to the HOPD, if you had an option to go to the ASC, you would save that much money. So again, it's just giving people the cost options. Yes, one that people get the choice to choose kind of, what plan they're, from a business perspective, because usually the business is choosing what entity they're going to insure through. And with that, you get one of two choice, a broad option or a narrow network option. So your choice, you still have choice, but it's limited. This, again, allowing House Bill 1416 allows patients to broaden that choice to see the providers that they know and trust and are likely right in their community.
Yeah, I think all of this stuff is, and you sort of touched on it a little bit there at the end, this is all sort of the illusion of trust. Like having, if this bill passes, there is an illusion of trust. Like, oh, great, now there's, I don't know, out of network, or I guess independent providers is what we call them, that maybe are now included in the plan. But the reality is that this whole system is designed to decrease choice for customers in terms of like how they get to spend their money. You have insurance companies who are trying to cut out their profit. You have providers who are trying to cut a profit while ordering unnecessary tests to protect themselves from frivolous lawsuits, while doing procedures that are unnecessary, because I don't have to lecture a doctor. Procedures are where you make your money. And so procedures may not be necessary. And all of it, you have a consumer sitting here watching their insurance company fight with their doctor. And in the end, they're sitting there waiting for care. And this bill, I can see why it benefits. And I think if I were the legislature, I'd vote for it. I can see why it benefits consumers. But at the end of the day, it's just, you get to have a harder time affording care at a wider range of doctors. Congratulations. Your choice is that you just have more people to help you go broke. So anyway, that's my little soapbox, and I'll give you a chance to respond.
Peter, I'll respond to that, Jamie. Thanks for bringing up that point, because I think there's something, if there is there's something called the right to shop legislation out there that's bouncing around in the U.S. and actually even in our state. There was a legislative management interim study that kind of looked at options to save money. So if you don't mind me noting, if you, for example, common quote unquote prices for selected common procedures in North Dakota, I'll be reading here just for a moment. But for example, for a colonoscopy, if you look at the 7 hospitals that they had listed, the most, again, the cheapest hospital, again, there's nothing cheap in healthcare, was $1,775. The difference, the highest, is $5,509. So again, this allows people to then go out and shop for, again, if you're stuck in a network, you get what you get. There's really no shopping allowed. If you're allowed to go out and choose, well, that's almost a $4,000 difference in savings. And what some insurance companies are doing is that if you go out and shop that price, you save them money, they actually give you money back. So again, they're saving on that deductible piece, they're saving the health system money, and allowing those folks to make that choice, again, I think allows these health insurance companies to offer, quote unquote, there's no cheap in health insurance, cheaper insurance for everybody. If you go to the next extreme, normal vaginal delivery, having a baby, the difference in hospitals, one is $4,343. The highest is $15,056. So greater than a $10,000 difference. And if you look at this study, the highest cost centers are at the vertically integrated network. If you behoove me, I'll give you some data. And I think this is important because it's kind of a larger conversation when we talk about the vertically integrated system. And this is a study from Source. And the information that it provides is what happens after healthcare mergers. When you go from when independent practitioners get consumed by a vertically integrated network, and what happens to the hospital costs. So this one quotes, and I can send you this so you have it, Rob, for a source. But I quote, so higher physician prices increased post-merger by an average of 14%. Cardiologist prices increased 33.5%. Orthopedic prices increased 12 to 20%. Clinic prices, so hospital-acquired clinic prices increased 32 to 47% within 4 years. Higher hospital rates and little to no quality improvement. So that's the vertical integrated mantra, is that they're stating that, this large vertically integrated system drives down cost, it's more efficient, provides better quality. The data suggests none of these things. More recent study in 2022, with reviewing 64 papers, International Journal of Health and Plan Management, said the same thing. So they looked at 64 studies on vertical integration. They all pretty much said what I just stated before. So again, vertical integration doesn't save cost. There's data to show it. So again, allowing patients to go out and shop prices, I think allows them to, give the consumer more control. I think drive down potentially their overall, definitely their deductible that they have to pay, saves the health system money, and again allows, I think, greater consumer choice and maybe even drives down premiums.
I think to Jamie's point, I feel some of Jamie's frustration, although I think if we had a debate about what to do about those frustrations, he and I would probably disagree sharply. But I understand the frustrations because we are talking about moving around some deck chairs on a Titanic that is really frustrating, because what we haven't really brought up yet, as we talk about consumer choice and everything, is the fact that most people don't pick their health insurance plan. I didn't pick my health insurance plan. I work for Forum Communications Company. My bosses picked my plan, right? And I have a great plan. As my bosses listen to this podcast, I'm very happy with my health insurance plan. It's fine. But I didn't choose it. I didn't choose the scope. I didn't shop for it. They do that, right? And they let me know what the changes are going to be. And I guess I could opt out of it and go out on the market, but I'm not going to find as good a deal as an individual person. Try buy health. So most people are like that. Most people either get their health insurance through a government program like Medicare or Medicaid, or they get it through an employer. That's most Americans. And so, like, the idea that like empowering consumers and everything, we're already severely constrained in our ability to make choices that might impact the downstream costs of our care. And part of the problem is a lot of us don't think about this until we're already sick, at which point, not a good time to be making, decisions, or you just can't shop. I mean, sometimes we talk about shopping around. If you need care quickly, you can't shop around. So, I mean, those things are tough. And I think that maybe speaks, and Jimmy can speak for himself, but I mean, I think that speaks to some of the frustration he's talking about. But I mean, that's why I support this bill. And I realize that's hard to say because we're operating in the context of a system that is already not great. But I think the argument here is let's not make it even more not great by continuing to allow this vertical integration to go on the path that it is. I mean, I think we've got to pull back from that because it's leading us in a direction we don't want to go. That's how I'm seeing this. As I made my little speech. Did that address some of your point, Jamie? I mean, I don't know if that's some of the frustration you're talking about.
There's frustration, but my frustration is insurance companies make profits by denying coverage. And that's as long as insurance companies exist, that's always going to happen. So, right. But yes, think
of what's going to happen when your doctor also works for your insurance company. Just think how great that's going to be.
I don't know. I lived in the I'm not going to go into detail. I lived in the UK. I experienced their healthcare system infinitely better than the US when it comes to access to care and cost. But that's a debate for a different day. I know.
We'll have that debate
that is
another time.
That's the ultimate integrated system, and it functions well in every country in the world except for ours, pretty much.
Yeah. Well, I think if you're going to go to that integrated system, it has to be something through the government. Otherwise, because if you do it, if you vertically integrate, it's like the worst of both worlds, right? It's like you have no choice, and you're also still locked into the for-profit system, right? That seems like the worst of everything, and let's not go there. Anyway, Duncan, anything else? I know there was a big hearing on this yesterday. Oh, I did want to ask you about this, because I think that's the other thing, is maybe people listening to this are saying, well, of course this guy wants this bill. He's a partner in some of these independent businesses. He's just a businessman. There's a part of this bill that I think is worth some explanation, because it doesn't just say that, that healthcare, insurers can't, it doesn't just say that they can't lock out independent healthcare providers. You have to meet some standards. I mean, you have to be in the geographical area. You have to be willing and fully qualified to meet the terms and conditions of participation as established by the insurer. So translate that. I mean, what does that mean? Because to me, I read that and it's like you're not asking for a blank check here.
Correct, and that was my point earlier too. It's not any link provider at any link price. The insurance companies still control the fee schedule, so there's still negotiations that have to happen, in order to kind of say, well, what we get paid as independents for a particular type of service. So that doesn't go away. They also get to determine the terms and conditions, that we have to meet. So again, they still have complete control. So again, it's their argument is that this is going to drive up cost, and we can no longer offer these plans because we don't have this, defined network of folks. And now you're going to have, basically these independents trying to take patients out of their network. If you think about it, there's not many healthcare providers in our state. If you think about orthopedics in general, my particular specialty, there's right around 50 of us, plus or minus. The independent groups, we're down to a handful, so we're the largest group in the state now with just 10 orthopedic surgeons. The Grand Forks Valley Bone and Joint, they joined Sanford. So with our group, there's maybe one or two small independent groups in the Fargo area. After that, everybody is employed. So again, it's like we're not asking to be paid, what they're being paid. We just want, what you pay yourselves, that's all we're asking for. So it's not, like I said, it's not, I can't go and ask them and say, oh, geez, I want X number of dollars and they have to pay it. That's not what this does.
Well, the legislation we've been talking about is House Bill 1416. If you read my column about it today and you click the link, House Bill 1416, it'll take you to the state legislative website. You can, and by the way, if you haven't been checking out the state legislative website, they have a great website. I've probably been remiss in not talking about it. The updates they've done to the legislative website this year are phenomenal. You click through to the bill overview. You can not just read the bill and its different versions as it gets amended. You can see the actions on it when it gets voted, when it gets scheduled for committee hearings. You can look up all the video on it, including the committee hearing testimony, the floor debates on it. You can actually read the submitted testimony. All the PDFs are there. It's really, really good. House Bill 1416. If you're interested in this, I would recommend you go there and review some of that stuff. And I mean, they even have it's so helpfully listed. They even have the testimony listed by testimony in favor, testimony opposed, testimony that's neutral. You could go through and really get a good flavor for this debate. And this is an important bill. So, Duncan, thank you so much for your time coming on.
Thank you. Appreciate your time.
Hi there, my name is James Wallner. I produce and host the podcast Dakota Spotlight, a true crime podcast that tackles historical and unsolved crimes in the upper Midwest. Follow along with me as we search for a missing girl, attempt to solve a 45-year-old murder, and much, much more. That's Dakota Spotlight Podcast, anywhere you get your podcasts, or at inforum.com/podcasts.
Well, just finished up our interview with Duncan Ackerman, and the one thing that we all agreed on, and we talked a little bit as we were saying goodbye to Duncan when we were off air there for a moment, is that our current healthcare system in America is broken. And I don't want to give anybody listening to this the idea that I'm like endorsing like our system is working fine. It is not. Unfortunately, the fixes for that lay well beyond the scope of what the North Dakota Legislature can do. We are in the here and now, we're tasked with operating within the system as it is. And I think what I would like the North Dakota Legislature to do is to avoid allowing it to get worse. And I think allowing more vertical integration from companies like Sanford, and then allow them to sort of price pressure people into, basically limiting their own choices, I think it's a very bad mistake that if we allow it to continue years down the road, it's going to be another thing where it's like, well, how did we get here? How do we unravel? How do we put this toothpaste back in the tube? You can't. The time to stop it's now. So anyway, that's why I support that bill, and I guess we'll see what happens to it down in the legislature. This similar bill was it passed in much as this session. 1416 has already passed the House this session, but it died in the Senate last session. So I don't know what'll be happening. One wrinkle, Jamie, that I mentioned in my column today is that a major, I guess you would call them independent. They're at least independent of Sanford. A major healthcare provider in our state is Trinity Health in Minot, based in Minot. They're not big by any standard other than North Dakota standards, but they're a significant player. Two members of their board serve in the state Senate, Senator Karen Krebsbach and Senate Majority Leader David Hogue. And it's going to be interesting to me to watch because there are rumors that abound about Sanford maybe buying out Trinity. So are these two members of Trinity's board going to fight to allow, because that's one of the things is Sanford could lock Trinity out of these health insurance plans, these vertically integrated health insurance plans. They could lock a provider like Trinity out. So is Trinity going to fight that? You would think they would want to, but if they're quiet, then what does that mean about Sanford maybe buying up? I don't know. Maybe I'm in conspiracy land, but
yeah, you're definitely in speculation land for sure there. And I don't know. I tend to think that if people have a potential conflict, like being on the board of, in this case, the board of Trinity, as long as that's known and people talk about it, at least that can be debated openly. I think it's when people try to hide their conflicts that there's a problem.
Yeah.
But
I'm not necessarily...
having been born in Trinity Hospital, I support whatever is good for Trinity Hospital. They did a good job for me 44 years ago.
Yeah.
So I will always appreciate them.
That one time they did a good job. I still go to Trinity. In fact, I was just at a Trinity doctor yesterday with my daughter. So I just, I think Trinity's great. Trinity did great for me when I had COVID. And nothing against Sanford doctors, by the way, either. Sanford employs a lot of great people. Don't get me wrong. I'm not trying to besmirch anybody's reputation, but there are motivations here that are not necessarily pro-consumer, I think. But we just had that debate, and it'll be interesting to watch how that unfolds. Another debate that's unfolding before the legislature, which we just saw this week, Representative Jim Casper is taking aim at the term limits amendment that was just added to the state constitution by voters. Now, there's a lot of hot air flying around about, slapping voters in the face because how dare you touch something that they just passed. I think we have to remember that I don't know to what degree the voters endorsed every aspect of that term limits measure that was on the ballot. It was debated on a very short timeline because I think if you remember that the state Supreme Court added it back onto the Constitution, so the time window we had to vote on it was very limited. And this is anecdotal, Jamie, but a lot of the people I talked to, frankly, thought that they voted for congressional term limits, which depresses me because I wish people would read what you're voting on more carefully. But on the other hand, it's like we're kind of stuck. Anyway, the legislature wants to amend it, and not to get rid of term limits, but what Representative Casper's proposed is going to longer term limits. So it would be 12 years instead of 8-year term limits. And then it would also allow you, once you term limit it out, if you sit out for a cycle, you can run again. Now, I support that, but then again, I oppose term limits in the first place. I think the voters ought to be able to vote for who they want to vote for. And if it's the same person over and over again, hey, you get the government you deserve. So I had a problem with that to begin with. But the part of this that's really controversial is there was a portion of that measure that was added to the state constitution that says that the legislature is not allowed to initiate an amendment of that portion of the Constitution. Now, to be clear, any constitutional amendment in North Dakota, even before term limits came along, had to be approved by the voters. So whether it's initiated by petitioners gathering signatures or if it's initiated by a vote of the legislature, it still has to pass with the people. But they did put that section in. And so now the pro-term limits people are saying, oh, well, this is unconstitutional. The Constitution now says the legislature can't amend this portion of the Constitution. Other people, including myself, say that's unconstitutional. You can't block the legislature from legislating. Otherwise, what's the point of having a legislature? So having put all that on your table, what are you seeing of this debate, Jamie?
I'm with you. I did not support that measure. I don't think term limits are necessary in North Dakota or in most places, and except for executive. Like, I think I'm okay with it for the governor's office. I'm certainly okay with it for the presidency. But for legislative offices, I just don't think they're as necessary. I actually think they can do harm. I look at the 8-year term limit that was passed, and people think that they're doing something by limiting the terms of the members of the legislature. But what they're actually doing is giving more power to lobbyists and to bureaucrats who work for the executive branch, because now they're the experts, and you will not have the legislator who spends enough time becoming an expert. And on top of that, I think you end up having serious churn in leaders and committee chairs, which will just slow the whole thing down. But we had that debate last year, and I lost, you lost, those of us who agree with us lost. I think that Casper's proposal is pretty good. If you're going to have term limits, I think what he's proposing is good. I would vote against it because the voters made it clear last year, whether you think they read it or not, or what they've said afterwards or not, the voters made their choice. And it's one thing if we go through that for a couple of years, or we experience it 8 years from now, what actually happens when you lose a bunch of people, then maybe make a change. But the fact that they just passed it, we as North Dakotans just passed it, and now you have some legislators saying, I know better than you. I mean, it's classic Jim Casper, and it's classic mentality of many in the legislature who think they know better than North Dakotans.
Yeah, I might be more willing to buy that argument if they were throwing term limits away entirely. But they're not. They're not. What they're doing is they're saying, okay, you want term limits. What about these term limits instead? Because the voters weren't given a menu of options on the ballot. They were given one option. That was 8-year term limits for the legislature, 8-year term limits for the governor. So, I think because again, this has to go to the people again. The legislature can't do this unilaterally. So I don't mind the idea of the legislature putting this question before voters again, saying, well, you already voted for this. What about this instead? And if the voters say no again, well, okay, I guess we got the answer. But I think sometimes everybody likes to presume that they know what the voters want. And we have really, if you think about it, we have very few data points. We don't have a lot of public polling in North Dakota to begin with. And even public polling it's imperfect. It doesn't always give you the full view. And even a vote like this, I don't know, you could say give you the full view. If North Dakotans had another option, say 12-year term limits instead of 8-year term limits, which one would they have voted for? I don't know. What's wrong with asking?
When does it stop? Like, does every time we pass something, does the legislature, should they come back the next year and say, oh, let's put it on the ballot
Maybe
again?
If it's a bad
over
idea.
And over and over and over.
Maybe. If it's
I think the voters voted for what they voted for, and I think now we have to live with it. And I think we have to demonstrate the value of that or how it's bad or whatever. I think continually asking them to vote on the same thing over and over,
but it's not.
It's just silly.
I reject the idea. Let's talk about it in a different context.
It's the same principle.
Same principle.
The same
fair enough.
principle.
Okay, fair enough. Let's put it in another context. Let's say we're talking about a bond measure to build a new school, because we see this happen all the time, where they'll come through and it says we want to spend $80 million to build a new middle school. It's going to have this, that, and the other thing, and the voters say no. So then they come back and they say, okay, what about a $60 million school? And, we'll lower the cost, or we'll spread it, or we'll do it. And so it's a different proposal. It's the same concept, but it's organized differently. And they said, okay, well, you said no to this. Our need for a school remains. So now we're going to ask you a different way. I don't have a problem with that. And there is a point at which asking the voters the same question over and over again, maybe that's obnoxious. I just don't perceive it in that way. This is a pretty important issue. Again, the voters got one choice on the ballot. Let's give them another choice and see how they feel about that. I don't see that that's particularly arrogant. Now, Representative Casper, we should point out, he got ripped by U.S. term limits, who are the people who proposed this measure, because Jim Casper signed a pledge to them to support only 8-year term limits. And so now he's had to rescind that pledge to do this. And honestly, that doesn't look good for Casper. And I would just say this is a cautionary tale to elected officials. Don't sign these stupid pledges, and especially don't sign them when they're offered to you by out-of-state groups. This never ends well. Nobody cares that you sign it. The only time they care about it is when you break it. So all you're doing is boxing yourself into a corner so that you can't change your mind in the future, which I think is a dumb thing to do, because as new facts emerge and the world changes, sometimes you have to change your mind. So
yeah,
don't sign pledges.
It's interesting. I mean, on that point, candidates. I've advised so many candidates over the years. All candidates, they all get these pledges. They get all these surveys, these questionnaires from all sorts of interest groups. And I've always told candidates, don't sign any pledge, even if it's something you truly believe in, and don't fill out any of these questionnaires, because all they do is they all ask questions, or they're written in a way that's very pointed, that does not allow you at some point to change your mind. There is nothing wrong with a politician changing their mind. We often attack politicians for changing their mind. I think it's perfectly okay. And we should encourage a politician to say, you know what, I was wrong on that.
Depending on the circumstances. If you're going around and you're pandering, if you're going around just telling everybody what they want to hear, that's a different matter. But if you've had John Maynard Keynes had a great way of putting it. Somebody said, you went back on what you believed before, and I'm paraphrasing here, but he said something along the lines of, essentially, when new facts emerge, I change my mind. What do you do? Right? Yeah. And I think it's to your point, it's fine to change your mind. Explain yourself, explain why you changed your mind, but there's nothing wrong with changing your mind. And don't sign these pledges that sign you up to a death, like a suicide pact or something with some special interest group. That's a terrible idea.
Yeah. And you bring up an example of the bond issue. I remember living in Grand Forks, late 90s, early 2000s. I lost track of the number of times I had to vote on the Alaris Center.
Right.
Before we finally built the Alaris Center, which in the end ended up being a great thing for the city. But I don't know. I guess there's part of me, and maybe I'm being hypocritical when I say this. I guess there's part of me that feels like if the voters say no to
flip-flop.
The voters say, if the voters say no to something, putting it before them again to say, give it another chance, like here's how things have changed, or here's maybe better information. That feels a little bit more acceptable to me than when the voters say, nope, we're going to make this change and this is what we want. I guess to me, the example of the term limits thing would be if a bond issue passes in some school district and then the next election they ask to add to the bond or something. That would, to me, would feel a little bit like this term limits thing, which is like, no, they already spoke, they said what they wanted, they spoke in the affirmative, and now you're trying to get more or different. I don't know. I have to think about how I actually feel about that, but it just rubs me the wrong way that there are legislators who are trying to do something different than what voters just passed.
I generally don't have a problem with asking the voters about things, and that's essentially anytime the legislature puts a constitutional amendment on the ballot. That's all they're doing is they're asking the voters to weigh in. And what are we afraid of? I mean, the voters said, well, I mean, if the voters are, and obviously people are going to be like, well, Port, you don't like the initiated measure process. You don't like populism. You often compare it to legislating by a mob. And yes, I do, but it's the system that we have. And if the voters are if they knew what they were doing when they passed term limits, the current iteration of term limits that we have, then they'll know what they're doing in 2024 if they get a chance to vote on this proposal, and they can say yes or no.
And the reality, I'm a progressive. I'm a Democrat in North Dakota. The reality is that when voters vote on issues, either through initiated measures or less often through referring a law, they're more often than not voting in my way, the way I would prefer them to vote, rather than the legislature, where my ideas are going to have minimal opportunity to pass. And so I agree. I mean, I'm not a fan of anything that makes it harder for voters to initiate measures. I think and that's a whole different topic than this one, but I think when they pass something, we should.
What did you think of it? It got voted down, but what did you think of that electronic signatures? Because I thought that was a good compromise in that we upped the number of signatures required, but we also allowed people to sign electronically, which also in turn, by the way, I think makes verifying the signatures a lot easier. And a lot more transparent in a lot of ways. I came around, as much as I, again, despise the initiated measure process. If we're going to have it, I thought that was a good compromise.
I think anytime a voter can engage with their government or, petition for redress, or however you want to call it, anytime that can happen more easily, I think it's a good thing. And so I think would be in favor of that. That especially goes to being able to verify what's real and what isn't. I mean, we saw what a mess it was last year, with not being able, or verifying and all that happened with, especially this ballot measure with term limits. So yeah, I would like to see something like that. I think if we look at the future, we're gonna have to start having discussions long term about how does voting change to adapt to technology and all that kind of stuff. I think the sooner we start embracing those conversations, the better we're going to be in the long term. Yeah,
which is going to be tough given the amount of suspicion we have about, if there's not a paper record of a vote. I don't know. I mean, it scares me because I'm with you. I mean, I'm not against moving in that direction, but also I don't want to create an opening whereby our votes can be manipulated, or people can claim that they were manipulated falsely and have millions of people believe them. To the point where we have a violent riot at the national capital. That's scary stuff to me.
I lived in Kentucky for a couple of years. I voted there. I think it was 2012, and I remember being uncomfortable because they were totally electronic. So you go to the machine, you vote. It doesn't print anything out like it does in North Dakota if you vote electronically.
Yeah,
it's just you hit enter and submits, and you're sort of trusting that your vote's going off into the cloud somewhere.
Yeah,
and
I like that there's still a piece of paper somewhere that's tied to me.
Yeah, me too.
That has my marks on it. I maybe call me old fashioned, but maybe I like that because it feels like at the end of the day, we could go back and find.
Someone can still count the paper.
I can find my ballot and say no, this is how I voted. All right, let's move on. The other thing, I guess I kind of broke the news yesterday talking about the last election cycle, which was such an eventful election cycle. Mark Haugen was chosen by the Democratic-NPL to be their candidate for the U.S. House of Representatives. He was chosen at the state convention. He was chosen on the June primary ballot. But by the time September ran around, Cara Mund had gotten into the race, and a lot of higher ups, dare I say elites in the Democratic-NPL party decided that they would rather have Cara Mund. They pressured Mark Haugen out of the race. And now Mark Haugen, it turns out, and I just got wind of this week, but turns out he decided, he was so burned by that, he decided to become a Republican. Now, to be clear, part of the reason why people were a little chapped that Haugen was the candidate for Democrats in the first place is he's pro-life. He's I don't know what you want to call him, kind of a throwback to an old like a Catholic Democrat. He's progressive on a lot of issues, but on social issues he has pretty traditional Catholic views. And there's a lot of people in the North Dakota Democratic-NPL that didn't like that. And so he got tossed off the ballot, and you saw a lot of that Democratic support went to Cara Mund, who then went on to the statewide ballot and performed about as same as every Democratic NPL candidate has in the last 20 years. So what do you make of Mark switching parties? I mean, I thought it was very interesting from two perspectives. One, to kind of like how does he reconcile the fact that he is progressive in many ways, joining a party that itself is having sort of an identity crisis about what it still stands for? I think that's kind of interesting. And then on the other side, you have I spoke with NDGOP Chairman Perry Schaefer, who said that he welcomed Mark with open arms, that Mark said that, Perry welcomed him as being a more moderate member of the party. Perry told me he talked to Governor Burgum, Senator Kramer, Senator Haugen, Congressman Armstrong. They all, welcomed Mark in. And I thought that's kind of interesting because, again, the party's at war with itself, where we have sort of a faction of, what do you want to call them, ultra mega, very Trumpy aligned people, and then maybe the more moderate Republicans in the mid. There's a lot of dynamics here that are interesting. What did you make of all that, Jamie?
First, I should say, any critique I give here of Mark's choice is not about switching parties. I switched parties.
I was going to say, I just remembered that.
Yeah. I worked for Kevin Kramer and Ed Schaefer in 96 and 98. In 2000, or 98, anyway, those late 90s, I was the state chairman of the College Republicans. I was on the executive committee of the North Dakota Republican Party. I was, the young Republican guy at the time. And so I switched parties like around 2002 for a variety of reasons I won't go into now. But essentially what it came down to was my values and principles did not align with the party that I was in. And so I essentially said, all right, I called myself an independent for a little while and then realized that my values much more aligned with being a Democrat. So that's why I switched parties. And it wasn't easy. I lost friends in the process. I still am friendly with those people when I see them, some of the names that you mentioned. But anyway, so I get why someone switches parties. So I'm not critiquing for that. I appreciate that Mark ran as a Democrat. You were at that convention last year, as was I. We were having a hard time finding someone to run. There was a perennial candidate who was going to trying to run as a Democrat, which would have been horribly embarrassing for us had he been on the ballot. And so Mark stepped up, and I appreciate that. He stepped up, and we knew what his views on abortion were at the time. So I didn't really like that, how it all went down when he dropped out. Some of my friends are people who really were encouraging him to drop, and they were supporting Cara Mund. He wasn't forced. He said he was dropped off the ballot. He wasn't dropped or forced. Mark chose to remove himself from the ballot. He could have stayed on. The party, I can tell you, the party absolutely would not have made any vote to take him off the ballot, even if that were legal. I don't know if it's legal or not, but even if it were, I can't imagine the party would have even made a motion asking him to. So it was people behind the scenes who encouraged him. Anyway, so we get to where we are today, and I don't think that, and I haven't talked with Mark about this, so I should probably reach out to him before putting my thoughts in his head, which are that I didn't get the sense in reading your article yesterday, which was the first I'd heard of this, I didn't get the sense that his transition to a different party was the same as mine or the others I've read about, where it came out of like I don't fit into this party because I don't believe the same stuff that all these people around me believe. His seemed to come out of, I didn't like how I was treated, and these people over here are treating me better. They're maybe nicer to me. They're more welcoming to me. And that seems to be the reason for the party switch, at least the reason as described in what he said with you in yesterday's column. And so I don't know if I like that as the reason someone switches a party. There are issues within the Dem-NPL in North Dakota. We need to get better in lots of ways, and I think we're going to keep working at it and trying to get better at it. I don't think that's why he left, though. I think he left because he didn't like how he was treated. he's going to have a hard time. I said this, I made the mistake. I commented on your Facebook yesterday, which is always a failure for me when I comment politics on Facebook.
I feel the same way about commenting on my Facebook too.
Yeah, and what I said yesterday was, I cannot imagine calling yourself a moderate or a centrist, and as a Democrat or even as a Republican, and looking at this ultra mega wing of the Republicans in the legislature who were trying to ban books and increase censorship, who are trying to do all of this stuff that is just counter to what a traditional, freedom-loving person believes. And look at these people and say, I want to be part of that. Not only do I want to be part of those guys, I want to help those guys get elected. It seems crazy to me that someone who believes what Mark believes and what he's talked about his belief and values are, wanting to be part of that. So I should talk with him about that. It's probably not fair for me to say it here, but anyway, those are the questions I would ask him if he were sitting on this call with us right now.
Well, Mark, and I don't want to put words. I mean, I interviewed him. I got, he answered my questions. I guess, my feeling is that he's not joining the Republican Party because he wants to be on the ballot again. I think Mark is somebody who's been deeply committed to politics for a long time because he really cares about issues. And so I think it's possible to join something like the Republican Party. I mean, listen, you're talking about the ultra MAGA wing that's making a lot of headlines these days. But the North Dakota Republican Party is huge. And it's a big tent. I would argue just by scope of the number of people they have elected to office right now is much larger than the Democratic-NPL and encompasses a much broader set of viewpoints than the Democratic-NPL does right now. Just by dint that they're a larger movement right now. And so the ultra mega wing is not the only wing of the party. And there are moderates within because I talk with them all the time, there are moderates within the North Dakota Republican Party who are trying to resist that. There are moderates in the legislature who are trying to resist that. Now, are they winning? Are they losing? That's a topic for a whole other show. In fact, it's a topic that we've done several shows on, some of which you've been a part of, Jamie. I guess to me, I can understand it. And maybe I'm saying that as somebody who identifies as a Republican. Although I will tell you, at these days, the way things are going, I don't feel comfortable a lot of times. I wonder sometimes, is there still going to be a place for someone like me in this Republican Party in the future? And if there's not, where do I go? Because I don't believe what the Democratic-NPL stands for. I say that. Democratic-NPL, I think they're nice people. I'm not saying that they're like evil or anything like that. It's just philosophically, there's not a place for me there. And maybe there's not a place for me in the NDGOP in a few years either. I don't know. But that's still an open question for me in the NDGOP. And maybe that's what Mark's... I don't know. Mark can speak for himself on that stuff. But I'll tell you, I think probably one of the reasons why... Kevin Kramer himself once told me this, and I even quoted it in my column yesterday. He said, the political movements win through addition, not subtraction, which you win by bringing people into your movement, not pushing people out. And so, taken at face value, this is a win for the NDGOP because somebody new came into their party, somebody who's obviously got a long history of being very active and pretty effective. That's a win for them, and it's a loss for the Democratic-NPL because you drove somebody out of your party, somebody who had been, in leadership roles, somebody who'd been on the ballot for the legislature, on the statewide ballot twice, although the second time ended, he ended up withdrawing. That's something. I don't know how you can look at that as a Democratic-NPL and be happy about that. Like I heard I saw some comments from left of center people on social media who were like, good, who needs them? Get out of here. And I was thinking, boy, that's a terrible attitude. Hey, by the way, that's the same attitude you want to talk about the ultra MAGA people. They're trying to drive the moderates out of their party too. And I don't think that ends well for either party. I guess that's the point. That's the way I look at it. Like, I think if I was a Democratic-NPL, this is something that would give me pause. I mean, you're already so tiny. You can't afford to lose anybody. And you just lost somebody who was willing to be on the statewide ballot for you.
Yeah. And Mark has a long history of, family history in the nonpartisan league, which is an important part of our party still to this day. Even within the Dem-NPL, there's obviously maybe the number of people is not as large as the big tent of the Republicans, but you're seeing with this, there's a wide range of views.
Sure. That's fair.
But, the case that I make to Democrats when I talk to them in North Dakota, and have for a long time, is that for a Democrat to win in North Dakota, you probably have to get about 90 or 95% of Democrat votes. You have to get maybe 60, 70% of independents, and you have to get some number, maybe 20% of Republicans. If you want to win as a Democrat in North Dakota, that's the numbers you got to get, which means that generally you're going to have to demonstrate that your values are aligned, which I don't know if you call them moderate or centrist, but you have to demonstrate that your values align with the voters. Republicans, they just probably have to get about 95% of Republican votes, and then they're good. They don't really have to worry about getting any Democrat votes and probably minimal independent votes. And we're seeing just because by nature, North Dakota has more Republicans, we're now seeing the effects of that in what I think is going to go down as the worst legislative session in history in terms of the crazies proposing legislation and passing legislation. We're going to feel the effects of this legislation for years. It's going to cause damage to business. It's going to cause damage to the economy. It's going to cause damage to people's lives. We're going to lose people's lives because of some of the actions taken this session. And I don't get why good people who are Republicans many of them are sitting by silently watching this happen, thinking this is a phase. This is going to pass. We'll go back to the old way where we all sort of got along better. There is no going back to the Republican Party. This is the reality that you're living in now. And unless people start leaving it or vocally fighting back, it's not going to get better. It's only going to get worse.
Well, I share a lot of those views, which I hope is evident from my writing on these topics, because where a faction of the Republican Party is going is a place that I don't want to go. They're going down where it's motivated by illiberalism. Like I don't want to just stand against whatever liberals are for. That's not conservatism for me. To me, conservatism is a whole separate philosophy and a whole separate of ideas that are often in tension with liberal or progressive ideas, but sometimes aren't. And it's not just about being whatever the left is for. And so I think that becomes a real problem, and it's really scary for me to watch a lot of this stuff, because I think some of the people that are rising up in the Republican Party are scary. I mean, the District 2 Republicans just elected as their chairman a man who threatened the Grand Forks City Council. That's scary to me. That person has no business in a leadership position. And I think you're right. There's a lot of Republicans right now, and I've talked about this before, and I've written about this before, but a lot of what's going on in the legislature right now is not reflective of where most North Dakotans are, even understanding the fact that most North Dakotans who have a partisan affiliation are Republicans. I think there is a major disconnect between the way this legislature is governing and where the North Dakota public is at. And I think people hear that and say, well, the North Dakota, that I'm somehow describing the electorate in North Dakota as being more liberal than they are. I don't think that's true, right? That doesn't make the Democratic-NPL right about issues. It just means that, and I think if you look at the candidate selection process where you go through, and again, I keep using this example of the Becker v. Haugen race as a data point, but I think it's a good one, where if you look at the way district convention delegates voted at the state convention, Becker v. Haugen, versus the way people from those legislative districts voted in the general election in November, there is a major disconnect where Haugen almost loses at the state convention, wins in a landslide over not just Rick Becker, but also Katrina Christensen, the Democratic-NPL candidate, wins in a landslide on the statewide ballot. That speaks to a disconnect. And the reason that's happening is the people who show up at these little district conventions that only have dozens or maybe at the outside a couple of hundred people attending, they're very, 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 a lot of them are in this kind of mega world, and they're the ones who are selecting the district leaders. And then those leaders are manipulating the process through which the candidates get the endorsement at the local convention. And then by the time it gets to the June ballot, the person with the convention endorsement has the advantage on the June ballot. And then by the time we get to the general election, more often, shouldn't say more often than not, but a lot of the time, there's no Democratic-NPL candidate at all. So it's a lot more complex even than what, I mean, you have a point, Jamie, but it's a lot more complex even than what you're saying, because even within the Republican Party, the moderates have kind of checked out, and that has allowed some things to flourish that should not be flourishing.
It is. And on the, I'll talk about Dems in a second, because I agree with you, Dems need to do better. But on the Republican side, this is a self-perpetuating in that the people, the mega folks show up, they exclude everyone else through just sheer numbers. And I mean, that's the system. So,
in District 2, they held the reorganization committee. They held it on a day where their legislators couldn't even attend.
Yeah.
Right. I mean, that's amazing.
So they show up, they win, they change rules to make it easier for them to win. This last year, everyone sort of patted on the Republican side, sort of patted themselves on the back and said, "Oh, we renominated or we re-endorsed John Haugen at the convention, which was closer than I thought it would have been." And then on top of that, they've elected Perry Schaefer, who's certainly not of that wing. But that's only because they didn't have enough votes on their central committee. That's going to change after this reorg. And so when I say it's going to get worse before it gets better, I mean, it's never going to get better. It's only going to get worse, because the more of them that sort of take over each district by district, the fewer there are going to be people who show up. On the Democratic side, you're right. We did not give enough voters choices. We didn't run enough people. I will say it wasn't due to lack of effort. There was serious effort. I was part of it. Fortunately, in my district, we were able to find candidates, but in lots of places it wasn't. The Democrats, we're having a discussion now of how do we move forward to have a robust, strong party that demonstrates what it is that we believe. I think our legislators are doing a great job with that now by talking about issues that I think most North Dakotans do agree with. Stuff like ensuring better access to childcare, talking about things like property tax reduction, talking about things like a coming crisis that we're going to experience in probably 10 years or 15 years when it comes to both home health care and long-term care, which is just not going to have employees or facilities to appropriately take care of our elderly. Democrats are talking about that stuff. The party needs to do a better job, and we're talking about how do we do it? How do we capitalize on this stuff? How do we take the good work our legislators do, make sure voters know about it, and then how do we capitalize on the fact that Republicans are going to start really turning people off, certainly independents, and probably a fair number of their own party off.
Well, that's. I mean, because I wanted that's, and we only have a couple minutes left, but that's where I wanted to go. Whereas, that's why I think the Mark Haugen thing is kind of important, right? Because there is a position where you could, right? You got to be looking at what's happening in the Republican Party. There's a lot of people who are going to be dissatisfied with where the party's going. So where are they going to end up? Well, they could end up in the Democratic-NPL, except you guys just kicked one of your moderates to the curb very publicly in the middle of an election, a guy who had stepped up on your statewide ballot. Is that the message you want to be sending to these people who are thinking, maybe I want to leave the Republican Party and find somewhere else? Am I going to be welcomed in the Democratic-NPL? Because Mark Haugen wasn't.
I disagree. He was kicked to the curb. There are some people in the party, you can call them elites. There are people in the party who are very powerful who told him that they wanted to drop out. He wasn't kicked to the curb. Mark chose to do it. But in any
chose
case,
to do it after basically being told that he's not going to get any support from his party.
I don't know what he was told. I wasn't part of those conversations, but
that's the way he's characterized it.
Yeah. What I do know is that sort of looking forward, I think Democrats were having good discussions about how do we do it. And I think it really comes down to organization. It comes down to having really good district, chairs. And this is getting really inside baseball but I'm guessing a lot of your listeners care about that stuff. It's about how do you have a good local district so that way you're getting to know voters locally, you're finding really good candidates locally. It's really hard for a state party, and I want to defend a state party a little bit when there's lots of openings on the ballot. It's really hard in a district out west for a state party staffer to come in to say, hey, I want to run you for the legislature, when there's no one to volunteer for them at the time because there's no district organization. So that's a hard sell for someone. Put your name on the line. We don't have a group to back yet, though.
That's understandable,
So
but
that's where we need to focus our efforts.
But like,
I think
ideologically,
over time it'll get better.
But okay, but I mean, is the party going to make room for somebody who's pro-life, who might be willing to vote for candidates who prioritize all the things you're talking about: elder care, child care, property taxes, but they happen to be pro-life? Is your party going to make room for somebody like that? Because that's the sort of person who might be willing to you say, of course. But Mark Haugen, again, he left the ballot for a reason.
You're right, Mark Haugen. There are some people who didn't like the fact or thought maybe there was going to be a better chance with a different candidate using the choice issue. And so, but Mark chose to drop out, and that's fine. Mark didn't want to run at the end of the day, and that's okay. But I don't think that the party overall, I don't think most people in the party are going to go around and start trying to kick people out based on some differences in issues. But there are some core issues that I guess I would probably question if I have any of our legislators vote for some of this, censorship bills, banning books, voting for some of these anti-LGBTQI bills that I think are going to cause damage and harm to people. I guess I would probably talk to them about, like, why are you a Democrat if you're voting for this stuff?
Yeah.
But I think those are fair conversations to have.
Well, I think it is. I think it is fair conversation. I worry that what's beginning to happen in the NDGOP right now with the sort of ultra MAGA wing, taking over the party, I think has already happened to the Democratic-NPL, and there's not a lot of room. I mean, because it's not just
you're not in the same rooms I am. I'm telling you, it's
okay,
not some,
but it's not just Mark Haugen. I remember when Heidi Heitkamp, who was the only Democrat elected on the statewide ballot, got censured by her own party's delegation to the national convention in 2006. What was it? 2000. I'm forgetting now. 2014. I'm forgetting. No, it was the national convention. I'm forgetting.
It would have been
2016, maybe. I don't know.
You could go back further. In the mid 2000s, there were liberals. There was this big group of fairly far left liberals who wanted to run someone against Earl Pomeroy for the endorsement.
Right.
Like in parties, there's always going to be like that wing of the party trying to pull the rest of the party to the left or to the right. I don't think in the Dem NPL, I think we're doing a much better job trying to be cohesive of everyone. The Republicans, they're just going full tilt far right, and there seems to be nothing to stop them. We're not going to agree on this at all.
It is a lot easier to organize, I think, a party that has become as small as the Democratic-NPL has. I think it's just fundamentally easier. I mean, it's
by the math. Look at
even within the legislature. I mean, you go from Senator Judy Lee, longtime Republican from Fargo, to Senator Jeff Magrum from District 8. That is the ideological spectrum that the NDGOP has to somehow reconcile and lead. You tell me that that's easy.
I mean, some of our best Democratic legislators are Republicans, and so I think no, I say that just because I'm just trying to stir things up and cause some trouble over there.
Yeah. All right, Jamie. Well, that's it. We're way over time. I appreciate you coming on, Jamie. It's a good conversation as always.
Happy to do it.
Did you know Forum Communications Company has a robust podcast library? At inforum.com/podcasts, we have everything from politics, sports, true crime, outdoor adventure, and more. Visit inforum.com/podcasts and explore them all today.